A pattern of problematic thinking, feeling, and interacting with the world. Unstable relationships and self-image, impulsive and unstable emotions, as well as mood swings, are just some of the characteristics that make up a person with borderline personality disorder, or BPD. Today I would like to inform you about the other qualities as well as treatment for BPD individuals. Borderline personality disorder affects different parts of the population. According to Johnson et al.'s article, it affects 1 to 2% of the population, as well as 10% of outpatients and 20% of inpatients. And according to the I Hate You Don't Leave Me book, 15 to 25% seeking treatment are diagnosed with borderline personality disorder. And the Walking on Eggshells book says that 75% of those diagnosed with borderline personality disorder are women. So what are some of the causes for borderline personality disorder? Kernberg and Michelle's article say that many professionals say early experiences could be a cause, such as trauma or problems with the parents, as well as genetics and biological factors and problems with emotional regulation and impulse control. Linehan mentioned in Martinson's article believes borderlines react more emotionally to low stress levels and were raised in environments where they were invalidated, which creates adults who are unsure of their feelings. Grohall also states that social or psychological or a mix of any of the above could be possible causes as well. So how is someone diagnosed with borderline personality disorder? To be diagnosed, according to the I Hate You Don't Leave Me book, you must have 5 of the 9 criteria from the Diagnostic and Statistical Manual for borderline personality disorder. The first symptom is frantic efforts to avoid real or imagined abandonment. The second is a pattern of unstable and intense interpersonal relationships characterized by alternating between extremes of idealization and devaluation. People with borderline personality disorder often see others as all good or all bad, which can change daily or hourly. Because of this, they have a hard time maintaining relationships with others, be it romantic or otherwise. And that information is from the Borderline Personalities for Dummies book. The third symptom is identity disturbance, markedly and persistently unstable self-image or sense of self. Borderlines will at times think of themselves as all good or will be filled with self-hatred. They don't know what they want in life and really don't understand what their values are, according to the Borderline Personality Disorder for Dummy book. The fourth symptom is impulsivity in at least 2 areas that are potentially self-damaging. It could be spending, sex, substance abuse, reckless driving, or binge eating. The fifth symptom is recurrent suicidal behavior, gestures, or threats, or self-mutilating behavior. Self-mutilation is the hallmark of borderline personality. It can be cutting, burning, drinking alcohol, drugs, or any other forms of self-mutilation. Oldham mentions in his article that 60 to 70% of borderlines attempt suicide and 75% make at least one non-deadly suicide attempt. Also, in the Borderline Personality Disorder for Dummies book, it says that 10% of borderlines end up succeeding in suicidal behaviors. The sixth symptom is affective instability due to marked reactivity of mood. Their mood may swing from intense anger to depression, depression to irritability, or irritability to anxiety, says the Walking on Eggshells book. The seventh symptom is chronic feelings of emptiness. Because borderlines lack a sense of who they are very lonely. Because of this, they look for ways to fill the void. That was from Kreisman and Strauss's book, Hate You Don't Leave Me. The eighth symptom is inappropriate and intense anger or difficulty controlling anger. Borderline rage is usually intense, unpredictable, and unaffected by logical argument, says the Walking on Eggshells book. The last and final criteria for borderline personality is transient, stress-related paranoid ideation or severe dissociative symptoms. People who have dissociative symptoms have described it as looking down on themselves, kind of as an out-of-body experience. And that's from the BPD for Dummies book. Other traits mentioned in the Walking on Eggshells book about a borderline personality person are shame, lack of object constancy, undefined boundaries, control issues, situational competence, narcissistic demands, and many other different kinds of traits. The next thing I want to talk about is comorbidity. And what comorbidity means is having another disorder along with the one you have. And 90% of borderline personality disorder patients also have other psychiatric disorders. 50% also have eating disorders. 82% have multiple personality disorder, according to the Eggshells book. And MedicineNet also says that they have a comorbidity with narcissism as well. Borderline personality disorder patients are comorbid with antisocial personality or major depressive disorder as well. And those who are comorbid with these disorders are more at risk for having greater lethal suicide attempts, according to Oldham's article. Hall-Slavin's article says that anxiety, bipolar, and other personality disorders are also commonly comorbid with borderline personality disorder. Tadek et al.'s article mentioned something about gender differences in the comorbidity with people who have borderline personality disorder. There was a U.S. study mentioned in the article that said women suffer with more internalizing disorders like eating and anxiety disorders, and men suffer more with the externalizing ones like substance abuse and antisocial personality. The German study that was also mentioned in this article found the same thing. So there are no specific tests to diagnose a borderline personality like a blood test, but there are interviews that look for symptoms associated with borderline personality disorder. The professional will rule out other mental or medical problems before diagnosing someone with BPD, and that was from MedicineNet. Kernberg, mentioned in Martinson's article, coined the term borderline personality disorder. He said that diagnosis should be based on the absence of psychosis, impaired ego integration, and nonspecific signs like anxiety, impulse issues, and decreased enjoyment in life. The best known test for borderline personality disorder is the diagnostic interview for borderlines. It assesses 4 areas: emotions, cognition, impulse actions, patterns, and interpersonal relationships. One of the forms of treatment for borderline personality disorder is therapy. According to Grohol, therapy deals with underlying issues, emotions, relationships, and childhood experiences. There are many different forms of therapy used for borderline personality disorder patients, but I'm only going to briefly mention the main 2. The first one I want to mention is dialectical behavioral therapy, and this was developed by Linehan, and it targets suicidal or other destructive behavior. It focuses on developing skillful behavior and dealing with day-to-day issues. Group and individual, as well as phone calls to the therapist, are part of this. Grohol also mentions CBT therapy in his article, and this stands for cognitive behavioral therapy. This was developed by Albert Ellis, PhD, and it consists of 2 therapies, cognitive and behavioral. Cognitive focuses on the thought processes, and the behavioral part focuses on the destructive behaviors. It doesn't focus on the cause, it more so focuses on trying to change it. One of the more intensive forms of treatment for borderlines is a hospitalization. Borderlines are known for their frequent visits to the hospital, but they're encouraged to look for support groups, hotlines, or a therapist to reduce the cost because hospitalizations are very costly, according to Grohol. The typical inpatient stay is 3 to 4 weeks, but many do not obtain this because of the cost. And even if it temporarily stops the destructive behaviors, this amount of time is not enough to make significant changes in the personality. So partial hospitalization is recommended for borderlines. It's more healthy for them than inpatient is, according to Grohol. The last thing I want to mention is the medication. Philip Long, who's a doctor, says that some drugs may be appropriate, but not for long-term use, as episodes like depression only last a short time. As you can see, borderline personality disorder is a very complex yet interesting disorder. Many symptoms are characteristic of this disorder, from impulsivity to anger. The majority of people with this disorder develop others as well. Fortunately, there are tests and other forms of treatment to help an individual who suffers. I hope that through this presentation you have gained some valuable facts about borderline personality and how they affect the individual.